Welcome to another intriguing MDC style question walkthrough. As always, we'll be tackling the past question from the MDC Recall question bank, and we'll be taking an opportunity to revise the topic from which the question was taken. So make sure to stay till the end. All right, so let's dive in. Today's question says, a man present with shortness of breath and cough productive of blood stain, putrid, purulent sputum. And we are giving the man's chest x-ray. The question says, what is the most likely diagnosis? The options are A, lung carcinoma, B, multibacterial lung abscess, C, tuberculosis, D, bronchitis, E, pneumonia. Now, we can see that the stem of the question is quite short, and if you've observed, most of the questions that come with some investigations alongside tend to have a very short stem. And the idea is that you should be able to read the investigation and gather more information to help you in making your diagnosis. So let's start with the stem first and see how much information we can get from that. And then we'll move on to the investigation itself. So we know the patient had shortness of breath, and there are several conditions that can present with shortness of breath, including respiratory and cardiac causes. But from the options that we've been given, they are all respiratory of origin. So we'll limit ourselves to respiratory conditions. So let's try and see. We'll try and check the boxes for each thing that we find relevant and see which of the options check all the boxes. So for shortness of breath, all these conditions can present with shortness of breath. So right from the word go, all the respiratory conditions that we've been given in the option can present with shortness of breath. So all of them check that box. The next is the characteristics of the sputum. We are told the sputum is blood stained, so there's hemoptysis. So let's find in our options if there's any condition or if any of those conditions present with hemoptysis. Lung carcinoma can present with hemoptysis. It is actually the second leading cause of hemoptysis globally. We have multibacterial lung abscess that occasionally can present with hemoptysis, so we'll take that too. Tuberculosis can also present with hemoptysis. In fact, tuberculosis is the leading cause of hemoptysis globally. So even in our setting, and that might be the only cause that you find in our setting. Not that there are no lung carcinomas, but compared to TB, we have more TB cases. Then you have bronchitis and pneumonia. Bronchitis typically does not present with hemoptysis, and so is pneumonia. Pneumonia does not typically present with hemoptysis, but occasionally you might find cases of patients who have bronchitis and come in with hemoptysis. So we'll take that. Then the next characteristic of the sputum is that it's putrid. Putrid means a putrefaction, so there's some form of a decay of an organ or a tissue. So putrefaction. So it had you can describe it as a rotten smell. So it means that there's some form of a necrotic tissue that is decaying and is producing that smell. So let's see which of these conditions can present with that. Lung carcinoma typically will not present with that. It's a neoplasm, overgrowth of tissue. So you typically will not have any dead tissue inside the lungs. So you will not have that putrid smell. In multibacterial tuberculosis, one of the classic sign, or one of the classic description of the sputum is that it's putrid. So that checks that box. And if you look at the pathophysiology of lung abscess, it is lung abscess formation is that there is dead or necrosis of the lung pericardium, and that necrotic tissue can now give you that putrid smell. Tuberculosis occasionally can give you that, but typically does not have that. And so is the bronchitis and pneumonia. So the only one that actually checks that box is the lung abscess. That's the only one that tends to produce that putrid characteristic smell. Now the next description of the sputum is that is purulent. Now, which of these conditions can present with purulent sputum? Lung carcinoma typically does not present with purulent sputum. Those are characteristics of infection, so infectious conditions. So that leaves us with lung abscess that can present with purulent sputum. TB typically does not present with purulent sputum, but occasionally you can have that too as well. So we will take that. And bronchitis, which especially in chronic bronchitis, one of the characteristic features is that it produces copious amount of purulent sputum, and pneumonia can also present with that. So from here, from the characteristics of the sputum alone, you've seen that the only condition that seems to have ticked all the boxes is the B, which is a lung abscess. But that's not all. We have an X-ray. So let's see. So we are basically trying to see which of the condition would check all the boxes. And so for lung abscess, I've checked all the boxes from the description of the patient's sputum. Now let's see if we can find more information from the X-ray to back the diagnosis. There are various algorithms for reading an X-ray. You should find one which is simple and easy for you to use. But as I said, we have a separate model on how to read the X-ray. What we'll limit ourselves here to is the lung field, where there seems to be a lesion, an obvious lesion in the X-ray. So let's try and see if we can identify this lesion. So right away, we can see that there's this radial opacity around the right perihelal region, and in the middle of this lesion, there is this radiolucency there. Okay, so but there's something else going on inside this lesion. There seems to be this straight line of radial opacity over here. So there's radiolucency in a lesion, in a radiopaque lesion located around the perihelal region, and this is a very thick wall cavity which is located around the right perihelal region with an air fluid level. Now the flattening of this surface here is telling us that there's some fluid and there's some air on top of it. Typically, fluid or water tends to take the shape of its container. So we were expecting that if it's fluid, there should be some kind of a meniscus, but we are not seeing that here. It's rather flattened. The surface of the water or the fluid is flat. It's because of the air on top of it, and that's an air fluid level. So this is a cavity. It's a thick wall cavity located around the perihelal region. So let's go back to our options and see which ones can present with cavitary lesions in the lungs. So lung carcinoma can present with cavitary lesion. Yes, it can. Lung abscess can present with cavitary lesion. That's actually one of the classic presentation of lung abscess, because once that necrotic tissue from the lung abscess is coughed out, once you cough that tissue out, that dead tissue out, you are now left with a cavity. And so that's one of the causes of cavitary lesions. Tuberculosis, also another common cause of cavitary lesions. Typically, the cavitary lesions from tuberculosis are mostly found in the apexes of the lungs, and this is because those are the areas of the lungs which contain high oxygen concentration, and the bacteria tend to grow in those areas. But of course, you can also find it around the perihelal region, as in this case. You have bronchitis. They don't typically present with cavitary lesion. Then you have pneumonia. As a complication of pneumonia, you can have a pneumocele. That is more like a cystic collection of gas within the parenchyma of the lungs, especially pneumonia arising from staphylococcus infection. But a complication of pneumonia can also be a lung abscess, and you can have a cavity as a consequence. So yes, so from here we can see that the option that has checked all the boxes together with the finding of the X-ray is a lung abscess. Okay, so this patient most likely had a lung abscess. Together with the X-ray findings, we are more confident that the patient had some form of a lung abscess. All right, so this is just an image, similar image as I shown you in the previous slide, showing you the annotation that I did. And this green overlay that you are seeing here is the wall of the cavity, and the red straight line here is the air fluid level that was demonstrated. So this is a thick wall cavity located in the right perihelal region with an air fluid level, and together with the symptoms and the characteristics of the patient sputum, the answer is multibacterial lung abscess. Well, so now let's take an opportunity to revise some differential diagnosis of cavitary lesions and call it a day. All right, so differential diagnosis for cavitary lesions. You can remember this by the mnemonic cavity, CAVITY. So C is for cancer. And the common cancers are mostly squamous cell carcinomas. They tend to present with cavitary lesions. So squamous cell carcinomas of the lungs can present with cavitary lesions. You can also have metastasis to the lungs. Also, squamous cell carcinomas metastasizing to the lungs can present with cavitary lesions. Autoimmune conditions, so granulomas, like so Wengen's granulomatosis is one of that, and now it used to be called Wengen's granulomatosis. Now it's called granulomatosis with polyangiitis. Can present with cavity lesions in the lungs. You have rheumatoid arthritis, present with rheumatoid nodules that can result in cavitation in the lungs. Then you have vascular lesions, so septic emboli. So emboli from the right side of the heart. So tricuspid endocarditis, especially in IV drug users, they can develop endocarditis involving a tricuspid valve, and a septic emboli can now lodge in the pulmonary capillaries and result in cavitary lesions. Then you have infections. You have both bacterial and fungal infection. Bacterial infection, especially in our setting, tuberculosis, and fungal infection like histoplasmosis and aspergillosis can also cause cavitary lesions. Trauma. So they most likely tend to result in the nematocele, which, especially in barotrauma, so if you have very high pressure in your mechanical ventilation machine, it can cause a rupture of the alveoli that can lead to a leakage of the air or oxygen into the parenchyma of the lungs. So you have cystic collection of air within the parenchyma of the lungs. So they are typically not cavity, but on X-ray they will look like cavities, and so that will come out as a differential diagnosis for cavitary lesions. Then Y for youth, which is congenital lesions. So young patients will present with these congenital lesions. So example is the bronchogenic cyst is one. You also have the CPAM, which is congenital pulmonary airway malformations, and this is abnormal proliferation of the bronchoalveolar airways, and you see it on the X-ray as multiple cystic lesions. Right. Then you have pulmonary sequestration, which is another congenital lesion that can present with, a cavitary lesion in the lungs. Okay, so cavity for the differential diagnosis for cavitary lesions in the lungs. Let's take a look at a few more X-rays. On this X-ray, you see that there is an irregular cavity located in the left lower lung zone there, and this was actually a patient. So you have the wall is quite thin compared to the thick wall cavity that we saw in the patient that we discussed. This is quite thin, irregular wall, and you have the radiolucency in the middle of it. So this was actually a patient who presented with fever and shortness of breath. Subsequent investigation actually showed that this patient had squamous cell carcinoma of the lungs. Then you have the image on the left. There's also a right perihilar lesion, cavitary lesion there. You have your radiolucency area in the middle, and you have your cavity in the right perihilar region. This was a patient who presented with shortness of breath, dry cough, low-grade fever, and weight loss over a 2-month period. For him, investigations showed that he had tuberculosis. But as I said, tuberculosis tend to present with apical lesions, but of course you can also find them around the perihilar region as well. So yes, I hope that was helpful, and for more details on lung cavities and lung abscess, you can always check out our module on that on our platform. See you in the next section.